Welcome back. A new survey has revealed that alcohol consumption is increasingly common among teenage girls. The study found that drinking has become a social norm for young women aged between 15 and 24. This is largely due to peer pressure, but the study also found that girls who refuse risk being teased or excluded by friends. Meanwhile, this year's budget introduced inflation-linked excise tax increases alongside proposed advertising restrictions from President Cyril Ramaphosa. Let's unpack this with Dr Zoe Duby, a socio-behavior researcher at the South African Medical Research Council Health Systems Research Unit. Dr Duby, a very good evening to you. Thanks for joining us. Teenage girls drinking on the increase. Tell us more.
Yes, thanks. Well, so we did this study as part of a larger study evaluating a health program for adolescent girls and young women, as you said, in this age group 15 to 24 across South Africa. And we were looking at outcomes such as HIV infection, teenage pregnancy, school attainment, and alcohol use, particularly problematic alcohol use, emerged as a really strong theme. And we realized that this was something that we really needed to investigate further. And it's interesting because while we see in some high-income countries around the world, we see alcohol use amongst this age group on the decline, in South Africa and sub-Saharan Africa more broadly, it appears to be increasing. So this is something that's really important to address in public health. And obviously with this alcohol tax, this was something that was very topical.
Yeah, and I wanted to ask you what's attributing to this increase, and particularly in young girls. Why not boys? Why is it the young girls?
Well, so our study was focusing on young women because we were looking at, particularly at HIV and teenage pregnancy, or obviously teenage pregnancy is an issue amongst young girls, particularly relating to school dropout. But also girls are much more likely to get HIV than males of the same age. So that's why our study was particularly focusing on girls. So we didn't actually interview young men and boys. But there are so many gendered and social factors that are leading to this behavior. So that was the sort of complexity that we were looking at. And what we found was that the social context within South Africa is making a space in which alcohol use is the norm. It's the normalized behavior for young women. So they are drinking either at home with family members, they are going out to shebeens, they're going out to taverns. And as you mentioned, it's seen as the fashionable thing to do, the trendy thing to do. And if you don't drink, you can be socially ostracized or rejected. So it sort of encourages this alcohol use amongst this age group, which leads to all sorts of other behaviors, which obviously end up in negative outcomes.
Yeah, and I also believe that your study found one of the attributing factors being that taverns are available, and some of the young girls saying there's a tavern in every corner and they can't even tell if they are underage. But we have a liquor board as well in South Africa that has rules to say where in what kilometer radius we can have a number of liquor outlets as well. It appears that in certain areas, particularly in townships, it's being flouted. So what can be done about this?
There's a really important point. We obviously see a lot of unlicensed liquor venues, particularly taverns and shebeens that are not licensed anyway, and they are not adhering to age restriction rules in terms of selling alcohol. So there's multi-layered aspects needed, increasing restrictions on the age restrictions around alcohol use. But we do know that young women are also getting alcohol at home from family members, or they're even asking adults to buy it on their behalf. So young women we spoke to said, we will do anything to get our alcohol. We'll make sure we get it, is in their words. So there's obviously alcohol is accessible, and because it's such a normalized behavior and it's seen as so fashionable, young women will go out of their way and sometimes putting themselves at risk in order to access alcohol. So we need to look at a broader social setting in which drinking no longer becomes the cool way to hang out with your friends. It's not normalized at birthday parties. at weddings, at funerals. You know, alcohol is everywhere these young people look. So that's what they end up, you know, emulating, copying the behavior of the adults around them. So it really looks at a sort of broader societal setting of alcohol use in the country.
And now, there's always talks about increasing the legal age for drinking, but Dr. Duby, if the research is also finding that these young girls are getting alcohol at home and getting it from their own family members, I mean, increasing the age limit might not even help.
I think that, you know, in terms of legislation, the really important thing is to create an environment where young people have alternatives to social behavior. And if we look at countries where youth alcohol use has declined, the kinds of behaviors, it's not about saying to young people, you can't drink at all. That's not realistic. But creating other types of places where young people can socialize, they can hang out without alcohol being the norm for that. So really, we, you know, in South Africa, we don't have many safe spaces, particularly in low-income communities, for young people just to hang out together. So that's why alcohol becomes this central part of socializing. So it's really about creating alternatives for young people and trying to make alcohol, or the non-use of alcohol, to not drinking, to make that cool instead of drinking and drunk is the way to get in with your peers and to be popular.
That will take some time, I also think, Dr. Duby, to change that kind of behavior as well. If these young girls are emulating what they're seeing not only in the home, but in society as well. Is this something that, you know, the next generation can achieve, or it's achievable in this generation as well? And how so, when young girls and boys are being pressured to drink and they're seeing in their environment that that's what happens?
So these social changes, you know, these shifts, they do take time. However, there are some things we can do in the short term about creating spaces for young people to hang out safely. We can also empower young people to say no to alcohol, and if we work on young women's self-esteem, particularly young women, to empower them that they don't need alcohol to be accepted, to be socially accepted by their friends. And we create opportunities for them. One of the biggest pieces we found was also that it's linked to mental health. So young women turn to alcohol as a way to cope with their stresses that they face in everyday life, particularly young women in communities, poor communities or resource-restricted communities. They face many daily stresses, violence in their environments. So they turn to alcohol as a coping mechanism, which is really, you know, is problematic. So by working on the mental health of young people, having programs that build self-esteem, that empower young women to make safer choices, that will go some way, and that's something we can do in the short term.
Dr. Zoe Duby, thank you so much for your expertise and sharing them with us this evening.